So adenomyosis is very difficult to diagnose and difficult to treat. Endometriosis is usually diagnosed by a surgical diagnosis, doing a laparoscopy and seeing endometriosis implants outside of the uterus, which is some kind of lining of the uterus, the endometrial cells, the cells that respond to the hormones outside of the uterus that grow and implant and cause inflammation and immune dysregulation. Adenomyosis is the same process, only those implants are not outside of the uterus, but in the muscle wall of the uterus, which is called the myometrium. And so now with some newer techniques, we can kind of get an idea on pelvic ultrasound, definitely with MRI. But generally, when I trained, you wouldn't know until you removed the uterus and had a pathological diagnosis. So the treatment would be the same as endometriosis. These patients would have more susceptible to bleeding. They wouldn't necessarily respond to an endometrial ablation or maybe even a Mirena. So a lot of times they do end up having to have a hysterectomy, but treatment would be the same as endometriosis.